Welcome back to BRMC's Healthy Connections, and we have been talking about various tools that assist people in so many ways. Deb Way with the acute inpatient rehab at BRMC, celebrating their 15th year.
Yes.
We're so excited about that. But you were talking about this, that you'd gotten one of these for your mom, so that she doesn't have to bend over to get things.
And although my husband is not as old as my mother, he's only like 62, but when he plays with Elvis, the dog. Elvis is the dog.
Elvis has been sighted at Mountain Home.
But he uses this to pick up things. And, you know, you can pick up something very light.
Right.
And you can pick up something a little heavier, like this. You can retrieve from a cabinet. Mm-hmm. This is not rated for like any big, heavy cans.
Right.
But this would do a soup can.
See, that would be wonderful, because so many people, they're either getting on stools and shouldn't be.
Right.
Maybe blood pressure issues, medication, so that, you know, they don't need to be bending over.
And they have vertigo. They look up, they get dizzy. They look down, they get dizzy, you know. And these are great tools to have to be able to do those retrievals.
Where can you get this?
Well, you can get these at like Davies and any of the DMEs in town.
Medical supply.
Yeah, you should be able to pick one up there.
Oh, okay.
Sometimes I've even seen them at like Walgreens.
I'll be darned.
In bigger places, bigger cities than what we have.
Yeah.
But you know, you'll see these kinds of things, and this doesn't require a physician's order.
Okay, that's
No.
Okay. I could see a lot of uses for that in the home. Yeah.
I'm telling you, I've been a therapist for 37 years. And I have never not had one of these in my home.
I think that's a wonderful idea. What do you call it when somebody...
It's a reacher.
A reacher.
Just a reacher.
Okay.
Yeah.
No special
fancy
name. Just a reacher.
It's just a reacher. And if you could not reach your water, I would be glad to assist you.
Thank you so much.
So I picked up about a pint of water.
Yeah.
You know, and I again, they're not rated for heavy things. And if I couldn't pick it up, I could drag it to me. You know, they're not an extremely expensive tool. I think you're going to look at $15 to $21, depending on where you would buy this.
And well worth it.
Oh,
well worth it.
You can actually pick up small coins.
Oh, my.
Oh, listen, I have seen people that are so awesome with this. You know,
out of necessity. Yeah. And very wise. I mean, to really, one more way to prevent falls in the home, prevent falls wherever you are. So
that's right.
Yeah.
I was at Walmart not long ago, and there was a woman that was doing her shopping, and she was looking at the different things on the shelf, and I had watched her kind of struggle a little bit, and I thought, oh man, do I offer to help? Would I insult her? You know, because you never know. Well, she couldn't reach something, so boy, she reached in her cart. She brought out a reacher.
Oh my goodness!
And she put it in her cart, and I thought, nah, she don't need
she's fine.
She don't need me. She's way ahead of the game.
Okay, got to be for the bath.
Oh, it is. Okay. I always recommend people have two of these, because when you're bathing, like if you're on a shower chair, you can use one of these for like your feet. You can wash the bottoms, all that kind of stuff. This is just a sponge. Okay. And you rinse it out thoroughly. But anything you can't reach, you can do this. And one trick I learned years ago is you can bend them. And when you do,
there's your back.
Oh, yeah. It's wonderful. Just go everywhere. And to have two of them, one of the things that makes that so important is to have two of them, and start off with this one just slightly damp, and put your lotion on here, and then rub your lotion in.
What a great idea.
You know, because how many times have you got out of the bath, there's no one at home, you're all by yourself, and you've got the winter itch, or you've got the sunburn of the summer, and these are great for that.
That's a wonderful idea. And where would you find those?
Now, these I get from Salmon's Preston. These wouldn't usually have to be ordered. I don't know of any of the local medical supply people that would have things like this, but they might. I don't know that. Yeah. But you could check with any of the local medical suppliers, or you can call us, and we'll give you the 800 number.
Oh, okay. There you go.
You can get one.
How can they reach you at the hospital?
870-508-3300.
3300. Okay, 508-3300, because those are wonderful.
They are.
The idea of lotion is terrific. that's really hard for anybody
It
to
is.
reach
Yes, it
with
is.
dry skin. And the older we get, the drier it gets.
That's for sure. And you know, when you talk about rehab, to me, this is like the foundation pieces to rehab. I've seen it grow and change tremendously in my career, and in the last 15 years at the hospital, I've only been there for 10, but I've watched it grow, blossom, and mature.
Sure.
And we have a lot of new things that I'll be showing you later, but these are still our standbys. These are there, and
The
they're
good old basics.
they're pulled out every day and given to patients.
Yeah. The everyday activities of daily living,
Right.
the things that you're going to need. Now, you had said is it the AFO,
Yes.
that needs a physician's
You gotta have a
order for that
physician's
to
order.
make sure that it's properly
Right.
fitted,
Yeah, because
molded.
we need, an AFO, you would need to know why, you have to have a diagnosis. Why would this be indicated? And that would have to come through a physician.
Okay.
Yeah.
But the rest, and what's your blue thing over
Oh.
there? We haven't gotten to the blue
This is
thing.
this is one of my favorite pieces.
Uh-huh.
It's a brand new one, so it's kind of not stretched out, and it's kind of holding its shape. Funny. But say my left leg is broken,
Okay.
and I've broke it several places, and I've got a cast on it, and it's heavy. And I can slide out of bed, and I can stand up on this leg, but I can't lift.
Okay.
So I'm sitting on the edge of the bed, and I want to lay down. I'm so tired. I can use my upper body strength, and I can raise my leg
Oh, wow.
and then get on in bed. And if I need to get up again, then I can put this on, and I can raise my leg, and I can lower it down.
And do it safely.
Safely.
Yeah.
Safely. You won't hurt yourself.
You're not hurting your back. You're
No.
only using your arms and your
And these
upper body
come in
strength.
different lengths. This is just a standard one, but you can also get them longer if you need them, because when you start dealing with a man who is 6 foot or greater, this
That's
is
not gonna work.
It's not going to be good enough. He's not going to reach his toes. But we use these. This is a great tool to have, and we have a lot of little tricks of the trade that we use. Like before we'd use this AFO, we might use an ACE wrap and wrap your toes and then wrap it around here so we pull your toes up. So, we use the most simplest, best approach to do muscle re-education and to get you moving.
Talk about, so everyone understands, this being inpatient, okay, they're going to come up and stay with you.
Right, they are.
But talk about some of your patients. They're not just stroke victims.
Oh, no.
So tell us about some.
Oh, we've had young men up there that were in car wrecks and had brain injuries.
Okay.
And you see personality changes. You see initiation changes in what to do. So sometimes you just have to cue them to do a certain thing.
Retraining.
We do cognitive education, cognitive retraining,
Okay.
To get them motivated. We see Parkinson's patients. We do a lot of some MS, the multiple sclerosis.
Okay.
We do general debile, and the reason I want to talk about general debile, people all know about, open heart surgeries, and they know about our strokes, and they know about all of the catastrophic things. But you have someone go in and they need an abdominal surgery for some reason. And they're maybe in their late 60s, early 70s, and they have the surgery and they run a little fever maybe, and they're not getting up and they're not moving, and they stay in bed and they get really weak. 2 or 3 days in bed, and you're going to feel it when you get up. So we take people sometimes, and they're diagnosed for us as general debility. And we bring them in because we need to help strengthen them to get them up and get them moving.
Get that core muscles back up and yeah.
And to increase them, 3 hours of therapy a day is a tremendous amount of therapy.
Oh, wow.
And we're open 7 days a week. Therapy runs all the time. Yeah. And 6 certified rehab nurses. So when I tell people we do rehab 24/7, we really do rehab 24/7.
So get them back stronger.
Right.
Because once again, there could be a fall issue.
Very much
something
so.
you go to the hospital for an abdominal problem, have your surgery, and if you're too weak when you're home or not getting the rehab, you fall and break something else. Here you go.
Yeah. So then you've got that new injury on top of the recovery process. And it can be so hard. I mean, we recently got a gentleman that had a fall and broke 9 ribs.
Oh my
had
goodness.
A bleed, from a head injury. Been on a vent. He's recovering. He's now with us. And, 3 hours of therapy is like walking on hot coals for 2 minutes, because that he's just not been doing that much.
Yeah.
So we take people at all functional levels.
And the entire program, the process is tailored to that individual and what their needs are.
It is. It is. When the PT and the OT and the speech therapist, if indicated, and the nurses go in, they evaluate you medically, all the way through everything that you would need to do to be independent. We review all of this with Dr. Elders, who's our medical director, and we formulate the treatment plan. First off, what is your goal? Well, if you're telling me you're still employed and your goal is to be able to go to work and you've got to be able to get up and down out of a chair 60 times in a day, for instance, just use that.
Sure.
Well, then I got to make sure
you're capable of doing that. You're strong enough to do that.
Right.
Your muscles really will allow you to do that. So, yeah.
And it's you listen to what the individual wants. You listen to what the family input is. And the reason I think it's important that the family's input be heard is when that individual goes home, that's who's going to take them home. And if they say, "Oh, I can do this, this, and this, and this," and they mean well, and I've done the same thing. But when it gets close to time to go home and we're doing the family education and we're allowing you to do it all, it's really an opportunity for the family to go, "Now, wait a minute. I'm not going to be able to do this." I'm almost 60. My husband outweighs me quite a bit.
Yeah.
I'm not going to be able to get him up and down out of a chair if he can't help me some of the time.
And a lot of times that goes both ways, because the wife thinking she can do it when in fact that's not a reality.
That's true.
And or the husband thinking, "Oh no, my wife can help me with that."
Oh yeah, right.
As they both, and I know you've had that happen where they both go over backwards.
We have people, we've treated people all the way into their 90s, and we have successfully helped them go home. And we do home evaluations.
That would be where your occupational therapy comes in, as
well as the PT gets involved in
physical
this.
therapy.
So we go home with you while you're still in the hospital, and we take the walker and all your adaptive stuff, all your things, and see if you can use them in your home environment.
What furniture has to be moved, what rugs have to go away.
Yes, and no extension cords.
No extension cords.
Yeah. And something as simple as measuring the bathroom door. Sometimes in some of our older homes,
very narrow
the walker
doorways
won't go in. And then you have to look at how it's configured. So, can they sidestep? Can you go sideways and sidestep in? Which is a very safe way to do it.
Is a bedside commode safer?
It's what we got to have,
Sure.
And we've even made recommendations on take this door off, take the door facing off, cap it, and you've got the room. Now that requires a very special individual who's going to be willing to forego privacy for function. And those are the things that we look at with people. If shutting the door is big for you, then that's not going to work.
Right.
But if being independent is going to work for you, then removing the door may be okay. And in the kitchen, I always tell people, all your favorites, and we all have them, all your favorites need to be here. Right here. You don't want to have to go and pull out the oven storage drawer to get your iron skillet out, which, a lot of people won't give them up. But, if that's what you're going to cook with, then it needs to be sitting on the counter and move this way.
Right. So you have to live with something not being hidden, but living on the counter.
Right. Because, it's real important when you go into the home to make sure that everything that the therapist and the nurses have taught the patient can be utilized there. So it's a way to see if what you've done in our controlled environment with our ADL kitchen, you can do at home with your stuff.
Exactly.
You know, because the kitchen's the ADL kitchen at the hospital is excellent to train with, but my kitchen doesn't look like that.
Right. Yeah. So how realistic would it be then? Yeah.
So if we can go home and do those things, it's real beneficial.
Deb, thank you so much for bringing all your stuff with us today, all your knowledge. That 37 years is just unbelievable. So
thank you.
Come and join us again soon, will you please?
I promise.
All right.
Thank you.
Thank you so much for being here. Thank you for being here with BRMC's Healthy Connections. We'll see you again next time.